We started this clinic in 2015 with a lot of support from different people taking a leap on creating a multidisciplinary program in movement disorders for teaching, research, and comprehensive care for people in the interior of BC. 10 years later, it very much looks like what we set out to accomplish. At least we're well on the way. I'm always surprised by how giving people are and how generous people are when they decide something's important to them. The foundation and the Humphreys family gift and the matching gifts and all the gifts that have followed have all helped support people alongside equipment. Most notably, it's allowed us to recruit another movement disorder specialist, Dr. Talita Cortez-Grip, who has unique skills and different perspectives on care and different research skills that will just bring so much vibrance to our clinic.
So I aim to see patients with movement disorders as a clinician, which is what I was trained for and which is one of my passions. And I want to see patients with Parkinson's disease, movement disorders, and also I want to perform the same types of assessments. So there are only 3 centers in Canada. This one is the 3rd center that we are able to look at the movements in a more objective way using neurophysiology. So this will be part of my practice. The best research we can do is usually focus on what the patients need. So I have this unique opportunity to be able to be in clinic with the patient and also do research at the same time. So I can really do very meaningful type of research because I can see day to day what's really impacting patients' life.
So right behind me is this ultrasound machine. And one of the first things that we did when Dr. Grip arrived, before she was able to independently start seeing patients while we were waiting for her credentialing and privileging, is she came and worked with me in clinic. We together saw patients with dystonia, a disorder that sometimes occurs in Parkinson's, and we could collaboratively examine patients and discuss their features, look at the ultrasound system, which was also a KGH Foundation funded piece of infrastructure.
Recently, donor support has helped fund a new FEES machine for our clinic, which is a flexible endoscopic evaluation of voice and swallowing machine, which for patients with Parkinson's, swallowing can be one of the main symptoms that they experience. So it's very important to be able to assess their swallowing function as early as possible and determine where they are at with it, whether they need treatment, and so on. And so now we're able to do that in a very timely fashion.
The KGH Foundation has worked with us and our hospital site operations to create something called the Evolve Award in Parkinson's disease at KGH, and that's been directly supported by the Humphreys Family Gift and the KGH Foundation Giving. And what that is it's funding that supports protecting time for a clinician to do program development work and research work. For Dr. Grip, we saw a lot of potential in her research and we wanted to make that part of our identity here. So the giving has allowed us to protect her time to develop those programs and services and her research.
I have hope because there's so many research going on, so much going on, and then every day we have something new, we understand it better. And I think we're moving towards to much better treatment and care of the patients because we understand what we are treating, right? We understand it better, we can personalize it better, and we can give a better quality of life for the patients, treating what actually matters for them.
So I would want donors to understand that the impact of their support for our patients has resulted in improved and evidence-based care and more efficient care. It could be your neighbor who benefits from that, it could be your friend, it could be a relative, and so any kind of donation will result in improved medical care for our entire community.
This is another step, but it's not the end point of our expansion of the clinic. We have really big plans. We want to make the clinic a real highlight of services in the interior of BC and in interior health. And we're only getting started with this new recruitment, the new equipment we have, the new services, and we're so excited to keep going.